So this is Danette, who's a healthcare worker from California. And she's looking pleased, and I must say I'm delighted as well, because she is being vaccinated with the Pfizer BioNTech vaccine as we watch. So excellent news, and of course you are welcome. Let's have a look at another healthcare worker being vaccinated. Very good news. This is Rachel from Colorado. Also looking pleased, and I share her delight. And if you don't mind, Rachel, we'll just have a look at your arm in a little more detail, because we see it's a remarkably small needle. I've been injected with needles that size many times. And we also notice that Rachel is being injected in exactly the right anatomical position. And that position is the deltoid muscle at the top of the arm. So if you put your hand on your arm and you flex it, you can feel your deltoid muscle pulling your arm up there like that. It's your deltoid muscle. Now, the reason I'm so pleased about this position here is I've actually seen quite a few videos of this, and a lot of people are injecting it too low, but that's right into the deltoid muscle there. So that's just the right place. So anyway, ladies, thank you so much for sending those in. Really appreciate it. Actually, I'll just read something out that that Danette said, the first worker we saw getting vaccinated. I got my COVID vaccine jab, Pfizer, on the 29th of December. She's a lab assistant. Very sore arm for 6 hours post the injection, so not surprising. And that lasted for about 12 hours, so quite a sore arm for 6 hours. 24 hours post-injection, only slightly sore arm. No other side effects other than feeling a little tired as of 26 hours. So excellent. And thank you very much for sending those in. And we really do celebrate that protection that you will be enjoying soon as your immunity develops now. And that's great news. Now, I'm afraid that's probably about the end of the good news for today. I think we'll just have a quick look at this from the UK, actually. The UK, it's on all the popular news outlets, so I'm not going to do it in great detail, but these darker areas are all tier 4 areas. And unfortunately, we see a lot of them. So tier 1 is described as high, tier 2 is medium. We don't see any there. There's none on that map. Tier 3 is very high. That's these lighter areas. And tier 4 is a stay-at-home order. Now, we don't see them there, but the Scilly Isles are about here. And they're tier 1. But that's the only place in England that's tier 1. And the situation in Scotland, Wales and Northern Ireland is equally locked down. Basically stay-at-home orders throughout the UK, with just these small areas of England that we see here still in tier 3. All the rest of areas in the tier 4 stay-at-home category. So there's no two ways around this. This is a difficult time. Now, I just want to put this in some context with some charts here. So let's just look at these. This is the graphs. Now, the United Kingdom, we know the cases are going up. Canada going up less so, but we notice a blip in the Canada data and quite a big blip in the American data from reporting delays over the holiday period. The United States will be resuming its upward case. We know that from other data that we're going to look at. Just some examples here. So the United Kingdom and Sweden, new cases again per million per capita. Germany a bit behind. So Europe not good generally at the moment. But when we look at the deaths per million, we see that Germany, the UK and Sweden are all on pretty similar levels. Now, this is the case fatality rate of the ongoing COVID pandemic. And we're looking at 3 countries here. It happens to be the United Kingdom, Sweden and Germany. And we see a dramatic decline. Now, this is partly due to the fact that hospital care is better and doctors and nurses are much better at treating COVID-19 than they were. But of course, the main reason that the cases are high here is less cases were diagnosed. If we looked at the infection fatality rate as opposed to the case fatality rate, we wouldn't see such a marked difference. But I think that's just useful to sort of put a bit of context into where we are with this pandemic at the moment. Now, I'm going to do a bit on the UK, a bit on the United States, and we are going to look further into that the new variant of concern. And of course, we're now that's in at least 2 states now, Colorado and California in the States, as well as all over the United Kingdom. Basically, this new strain is becoming the pandemic in the UK. It's basically taking over, and it's not good because it's more transmissible, as we now know. So just looking at the UK here, cases 50,000 in the last 24 hours, nearly 2.5 million officially diagnosed. Hospitalisations up by 2,430 in a 24-hour period, giving 23,771 hospitalisations with over 1,800 patients currently ventilated. That's not intensive care, that's actually ventilated. And you know, there's no two ways around this. This is a significant stress on the hospital healthcare system in the UK. And if we just look at the official data from the live feed here, we see this great increase in cases. Now, this is partly delayed reporting over the Christmas period, but not entirely, because the trend is upward. The 7-day average trend there is upwards. So we have definitely got this increase in cases. And when we look at the strain on the healthcare system, again, this is new patients admitted to hospital. See, that's continuing to rise. But as well as that, patients are staying in hospital for longer because there's more treatments available now. So the number of patients in hospital now is the highest it has ever been, by a reasonable margin, actually, over the peak now of the previous peak back in the 12th of April, I think, was the peak there. And deaths, of course, continue to climb. They can only climb. It's a case of the rate. Again, delayed reporting here. But basically, the death rate is much higher now. And we'll just look at some figures for that death rate as well in a minute. While we're here, we'll just look at the COVID Symptom Tracker app. That's giving new cases at over 57,000 at the moment. This is always a bit of an underestimate, of course, because of the fact it's only reporting symptoms. Am I on the wrong page here? COVID infections in your area. Yeah, so we see that these dots, we can start to see the gaps between the dots here, indicating the prevalence, the number of people with it at the time, and it's increasing as well. So both ways of looking at it, the official data and the COVID Symptom Tracker app, both showing increases. This is a follow-on from the previous page. We looked at the cases and the hospitalisations in the ventilated patients. The previous peak on hospitalisations, it's now, the official figure is now even higher than that graphic. It's 23,000 now patients hospitalised. In fact, nearly 24,000 actually in hospital as we speak, just with COVID-19. And of course, they've displaced many of the patients that should be in hospital. The previous peak, as we said, was the 12th of April. So the injections versus infections race, if we want to call it that. Vaccinations now are up to 616,000 in the UK. Now, the COVID vaccine, as we know, is starting on Monday. Now, the Oxford vaccine, the Oxford COVID vaccine, not quite sure why they're waiting till Monday. I suppose they're just getting everything ready, but we knew this was coming. So I must say I'm slightly disappointed by the delay. I would have hoped they would start vaccinating today, because we know the stockpiles of 4 million of these vaccine doses. So why they haven't started early, I don't know. A bit disappointing. But, and this is not a nationalistic point at all, the UK has actually vaccinated more people per capita than any other country in the world at the moment. And we'll come on and look at some of the difficulties that the United States is having, which is disappointing and a problem. I think it will be resolved, but as we speak, it is a disappointing delay. So deaths in the UK, again, I think that number's slightly inflated by reduced delayed reporting over Christmas, but 72,548 deaths within 28 days of a diagnosis. This is the addition in the last week for the data that we have on the official number where COVID is mentioned on the death certificates. So again, by both modalities of measurement, the increases are significant. And we've looked at the COVID symptom tracker output showing over 55,000 cases. COVID symptom tracker data is showing that 20% of people are completely asymptomatic. So to that figure of symptomatic reports, we need to add at least another 10,000 for another 20%. So this is high. Now, a quick report on the Swiss ski resort Verbier. About a dozen British tourists out of about 420 left in the resort obeying the regulations. Swiss Health Minister, we are aware of that. It's obviously a problem. There was an order to quarantine that has not been respected. As I've said before, this is a national disgrace for the United Kingdom that these tourists have behaved in such an appalling way and not obeyed the change in regulations that the Swiss authorities brought about quite justifiably when the threat of this new variant became so apparent. About 3,500 people from the UK went to Switzerland for Christmas, as if this is any time to be jetting around for a holiday. Right, that's all I'm going to say about that. These people consider themselves severely told off. Now, variant of concern update. So this is the new strain that is now flooding throughout the UK, out of control in the UK. Is not too out of control was the words that Matt Hancock used, and I must say I agree. It is becoming the predominant strain now very rapidly in the UK. And we've got a couple of we've looked at 2 papers on this already demonstrating the increased infectious or infectivity. So that's no longer in doubt. But this paper here is a collaboration from Imperial College London with the Medical Research Council for Global and Infectious Disease Analysis. And annoyingly, they seem to have changed the name again. It's now called B.1.1.7. Anyway, so we'll look at that in a minute. With it's what we have been calling the Kent mutation or the 2012 variant. Anyway, we'll come back to that. What this research study has said, and I've put it in direct quotations here to sort of emphasise it really. Available data indicate a shift in the age composition of reported cases, with a larger share of under 20-year-olds among reported variant of concern than the old wild strain, the non-variant of concern. So there is some indication here, and I wouldn't put it stronger than that, but it's a strongish indication that this is causing more infections or more symptomatic infections in younger people under the age of 20 than the old variant. Another reason why we have to be so rigorous at the moment, we don't want this to spread. Another reason why the lack of genomic testing in the United States is a problem. Another reason why the behaviour of the tourists who went to Verbier was so irresponsible. Have they spread this mutation around Switzerland and southern France? Is it infecting more young people? This indicates that it may be. We're going to keep a close eye on that, because this could change the shape of the pandemic over the next few months. This is a very significant finding. And I would have mentioned that, but it's from very reputable sources, so I think it merited a mention that this infection may be affecting younger people, more so than the old variant. Now, another paper that's been published on this, again, just in the last 24 hours, and again, they're using this B.1.1.7 notation, so I think we're going to have to switch to that. It proliferated in England in 87% of lower tier local authorities. So there was like 244 local authorities in the lower tiers, 1 and 2. And the variant proliferated in 213 of those. And we had thought it was more restricted to the southeast, but not so. It's everywhere. Now, what that meant was when these areas were in tier 1 and 2, the R value with tier 1 and 2 was 1.25%. That is rapid exponential growth. There's no question about that. That's terrible, absolutely terrible. So what this is saying is, if you have tier 1 and 2 level restrictions, you'll get an R value of 1.25 on this new variant. That's what it's saying. Now, at the same time, other lineages, the old-fashioned wild-type ones, the tier 2 restrictions, say, were good enough to start getting the numbers down on that. The R was 0.85. So we have exactly the same level of restriction in areas with exactly the same level of restriction at the same time. The new variant had an R of 1.25 and the old variant had an R of 0.85. So to get the R value below 1 with this new variant, we need much higher tiered restrictions. So that's the difference. Same level of restriction, new variant R125, 1.25, old variant 0.85. And that is really, if you can let those numbers kind of sink in, that's quite a powerful difference. Leading to 83%, 203 out of the 244 of the region showing the new variant of concern proliferation, while other lineages diminished. In other words, in 83% of areas, the new variant was going up and the old variant was going down simultaneously. Now, of course, that's partly because the old variant was replacing the new variant was replacing the old variant, but it's still a bad trend. So with that level of restriction, R equals 1.25 with a new variant, much more transmissible. Now, let's look at the United States now. Let's just look at the official data first of all, I think. So here we see the map. Just click on this, you've got the link. California, Arizona, Tennessee, highish. Rhode Island as well, perhaps. But there's the list there. So California now has got the highest number of daily cases, overtaking Tennessee and all the other states listed below. And if we look at the trends, again, we see this huge delay from the Christmas reporting. I wish it was genuine that the cases were going down so quickly, but they're simply not. This is a delay in reporting over Christmas. And if we look at the deaths, again, we see the delay in Christmas reporting. So when this kicks in again, we'll see an artificially high death rate for a few days. But we know that the trends are bad, unfortunately. So United States CDC, check it out for yourself. Now, US hospitalizations, again, this data's out of date, but let's look at the cases first of all. So cases in the United States, the best data seems to be showing 100,000, 225,671. It's getting on for 250,000 new cases a day, isn't it? I mean, it's a very high increase, and it's taking us up to nearly 20 million officially diagnosed cases. Anyway, the trend is up 6.97% over the past 7 days. And of course, that's with the lag in reporting, so the actual number is probably higher than that. Hospitalizations, current hospitalizations are 125,000. Very high. That's the number in intensive care, 7,930 actually on ventilators. Deaths in the States up to 333,000. Vaccinations in the States, 2.1 million vaccines have been given. And this, of course, is simply appalling. We expected 20 million by the end of today, the last day in December. And we've had 2.1, okay, we might get it up to 2.2, even 2.3. Very slow start in the United States, very slow start. let's hope that it improves. I mean, I can't say I'm happy with the 666,000 or whatever it is from the UK. And I'm very disappointed the Oxford vaccine hasn't started yet. But the number of people actually vaccinated in the UK, in the US, in the United States, actually really relatively low, and per capita lower than the UK. I really hope that starts to improve soon. I mean, there is, and of course the other thing is, with it being the States, the blame game started already. So the president shouting at the states for not sorting it out, and the states are shouting at the central government for not sorting it out. And the bottom line is people aren't getting vaccinated, and as we've seen, that's resulting in deaths. So I really do hope that the situation in the States improves dramatically and quickly. I think it will. I'm pretty sure it will. Now, let me give you a complete conundrum here. Oxford AstraZeneca vaccine, United States. Now, this is a report from CNN. Okay, so I know there's two sorts of people in the United States, those who love CNN and those who hate it. But it does seem to be an accurate report. So this chap, I don't know him, I can't even pronounce his name anyway. This doctor, Chief Scientific Advisor of Operation Warp Speed, which means very fast indeed. Speed's above the speed of light. Not that such a thing can happen, it's anyway, I digress. Right, so this doctor has said that the Oxford vaccine in the United States may be authorised for emergency use in the United States in April. But the good news is several tens of millions of doses should be manufactured in the United States by then. Now, is this right? Can this be true? So the UK regulator has looked at the data from AstraZeneca and Oxford, and they've decided that we can go ahead and vaccinate in the UK. We would assume that the FDA has access to the same data, but they're not going to decide till April. Now, they are doing more trials in the United States. The quality of the data will be higher in April, but also an awful lot of people are going to die and get very sick and suffer between now and April. So we've got the rest of today, 31st of December, then we've got all of January, all of February, all of March, into April, 3.5 months before people in the United States are going to be injected with the Oxford vaccine. See, I think the United States could do with a vaccine which costs $3 a shot, unlike the other ones which don't cost $3 a shot. And I think they could do with a vaccine that can be transported at just over, in normal refrigeration temperatures, 2 to 8 degrees centigrade. Now, I think I'm right in that assessment. I think the United States you could do with that. To put it another way, I think it's absolutely desperate for that. And yet they're talking about starting in April. What am I not getting here? Why don't they use the same data that we used in the UK to make our decision? And while we're on that point, of course, the European Medicines Agency is still silent on the matter. Europe is desperate for the Oxford vaccine. Why are these regulators delaying? Can it be that the FDA would delay for 3.5 months on the Oxford vaccine? Well, I hope to be back on tomorrow telling you that this is a mistake. But I don't think it is. And I just find it inexplicable. I mean, even the data in the public domain, I mean, all you can do is look at the data in the public domain, just from the peer-reviewed publications and the press releases. And you can think, yeah, this is fine, this is good, let's go with this. And yet the FDA presumably have all the rolling data, the same as the British authorities. And they're talking about April. I must say, I am bemused. I just don't get that. Anyway, right, United States variant of concern, the spread. We know about the 2 cases in Colorado. So I read a paper in the UK and it said this is the official name, VOC 2020-01/01. That was the official name last week. This seems to be the official name now, B.1.1.7. So anyway, it's exactly the same thing. It's this variant that was first identified in Kent. And there's a tradition with viruses to name them by the place they were first identified, like Zika and Ebola and things like that. So anyway, we're not calling it the Kent mutation now, we're calling it B.1.1.7. Right. Variant 17. The variant's got 17 mutations, 8 on the spike protein. So it's not surprising it's spreading more with these changes on the spike protein. And other data, nothing peer-reviewed yet, but the people with the new variant seem to have a much higher viral load, therefore shedding greater numbers of the virus. But despite this, they're not getting sicker. So there's a bit of a conundrum there. I don't fully understand yet at the moment. Provisional data saying they have a higher viral load, therefore it makes sense they spread more. So that would partly explain the increased transmissibility. And we also know that this change on the spike protein can make it bind better into the receptor site in the body's cells. So that all makes sense. The higher viral load makes sense that it would be more transmissible, but you would expect people with a higher viral load to be sicker, and they're not. So at the moment, there's a bit of a contradiction there. Can't explain it just now. Hope to be able to soon. So the first case in the United States was the Colorado one. Turns out it was 2 members of the National Guard. They're both now isolating in Elbert County. No travel history, according to the governor. So the governor has said there is no travel history in this case. And I think you know what that means. That means they picked it up by community spread. So that's not good at all. Indicating like community spread. Contact tracing ongoing. Now these National Guard members, this is something that's strange here as well. These National Guard members, on the 23rd of December, they were deployed to the Good Samaritan Society for Assisted Living Facility. 26 residents, presumably mostly elderly. They were all tested for the virus, and they all had the old strain, the familiar strain, the not variant of concern, the old strain. Sadly, 4 of them have died, so there's now 22. So strange. So you had these 2 young and presumably fit. We know one was a man. We don't know if the other man, one was a man or a woman. The man was in his 20s. Presumably the other person, man or woman, would be of military age. So 2 young people got the new variant, and yet the 26 older people they were working with tested positive for the old variant. Not sure we can make too much of that at the moment, but it's certainly interesting and potentially concerning if the virus, the new variant, is spreading more in the younger age group. But we can make nothing of that. I'm just sort of thinking out loud at the moment. Centre for Disease Control and Prevention have commented, could lead to more cases and place greater demand on an already strained health resources. Yes, it could. Now, the Southern California case as well. This is San Diego County, 30-year-old man tested on yesterday. Again, no travel history. Indicating that there are probably many such cases spreading around the United States. It will preferentially spread. This is simple evolution. It's much fitter in evolutionary terms than the other previous forms of the virus. Therefore, it will predominate and become the main form. And that will greatly increase transmission in the United States. At least it's in Colorado and California that we know of. Governor Newsom, California, this new strain that we've identified, obviously from the United Kingdom. Now, I just put that in because, again, this is not a nationalistic point. I think if you've watched a few of these videos, hopefully you know me well enough now, but I don't make silly nationalistic points. But he's saying, obviously from the United Kingdom. Well, no, it's just that the United Kingdom have got the best testing, therefore we picked it up earliest. 140,000 genomics sequences from the virus studied in the United Kingdom over the past few months. So it could have been, I'm not saying it did, but it could have gone from the United States to the United Kingdom and being picked up first in the United Kingdom. Because the genomic testing in the United States has been very, very patchy. So just it's not obvious. So it may be from the United Kingdom. We just picked it up first. Centre for Disease Control and Prevention. In November, they started a new programme to analyse genomes, and they seem to be proud of the fact that they eventually over quite a few months will get up to 3,500 viral genomes a week, as if this is good. Well, of course it's good. It's a lot better than what they have been doing. But they're hoping to build up to 3,500 a week in the UK. We've done 140,000 in the past few months. Per capita basis, the United States has somewhat missed a trick here, I think it must be said, in terms of genomic testing. So, the part of the reason I'm probably thinking about this is how much is the other mutation, this other new variant, still an N0501Y mutation as we looked at, spread through South Africa and other African countries, where the testing, of course, is even poorer. Well, basically in most sub-Saharan African countries, there's essentially no genomic testing, so we don't know. Francis Collins, director of the National Institute for Health of Human Genome fame, of course, he said this: if there was a reason to work really hard on stopping community transmission, we have an even better reason now, because we're up against a more formidable enemy. So obviously, as we've looked at, the restrictions that might have been keeping the old variant at bay will not keep the new variant at bay. Things are getting bad enough already, just from the previous viral strain, indicating it's going to get worse. So that's Francis Collins, director of the National Institute of Health. Right, I think that's about us for today. If you stuck with it, thank you. Just one more thing. I'm just going to mention Iran. Now, Iran really has been, obviously there's a lot of political stuff going on here, but it's the people of Iran that are in between these great international forces. On and off, I've worked with about 20 people from Iran, and I must say I got on with them all really well. And culturally, I find we understand each other really quite clearly. It's not it's different from the Middle Eastern culture, and it just grieves me that things with Iran are so strained. I would love to have much closer relationships with many colleagues and people in Iran, but very difficult at the moment. Launched human trials of its first domestic vaccine candidate. Now, 65,000 people volunteered for this, and the Iranians are doing a trial over the next 45 to 60 days, all quite reasonable so far, and they're going to recruit a total of 56 people for this vaccine trial. Yeah, I know. I couldn't compute it either, so I checked it. This is from Al Jazeera. They're recruiting a vaccine trial with 56. That's 50 with 6 other people. It's just unbelievable. Why are they bothering to do that? It's just incredible. Is this their vaccine trial? What is going on here? We would like 100 times that as a minimum. A minimum. Anyway, they're buying vaccine from the World Health Organization, led by the COVAX Alliance, so hopefully they're about to start getting the Oxford vaccine pretty soon. And they're planning to import a China vaccine. Now, there was a vaccine, I haven't got the full details on this, but there was a vaccine approved by the Chinese authorities today. But, not obviously, I'm sad to say I have seen no peer-reviewed official publications on that, as I have for the Pfizer and the Oxford vaccine. So, but it is being distributed now. The efficacy seems to be around about 80%, but it would just be nice if it was published, but it hasn't been that I'm aware of. Okay, I think that is us for today. Yeah, I think we'll leave it there for today. We've gone on quite long enough. So, of course, thank you for watching as always, and Happy New Year. And I'm sorry you can't have a party tonight. Well, you can in your household. You can celebrate with people on Skype. You can even drink some alcohol if you want, just not with mixing households. But no, this is the same all around the world. It's not just you that I'm getting at. This is the same for everyone. And also, next year will be utterly totally different, because at least in Western countries by then we'll have very, very high vaccine uptake, and it is my firm belief we will have essentially no problem with day-to-day lives this time next year. In fact, I hope a great deal earlier than that. That's why I'm really chomping at the bit to get these vaccine programs going. Okay, thank you for watching.